Good afternoon. I'm Dana Jones, the nurse practitioner that's recently started on with the bariatric team, and I want to talk to you this afternoon about the lifestyle and diet changes that our patients can expect to make with their bariatric surgery. So in coordination with our patient care team of surgeons, nurse coordinators, advanced practice providers, support specialists, dietitians, fellows, nurses, and medical assistants, we really want to make sure that our patients succeed, and we want to give them those tools to help them make those changes. So changing your life means changing your lifestyle. Following our structured eating plan, learning new eating and mealtime habits, and then making those lifestyle changes to promote success and then prevent complications after surgery, as well as adding an optimal exercise routine and several other lifestyle choices are going to be essential in making sure that you're successful after bariatric surgery. So the UIHC Bariatric Eating Plan is designed to promote weight loss, and it's structured for the bariatric surgery anatomy, as after surgery you're not able to process foods in the same way. We focus on a clean, whole foods eating plan that stresses taking in nutrient-dense foods rather than focusing on supplements like shakes or protein bars. So we really want to put the knowledge in the hands of our patients. We want to give our patients the tools that they need to make those healthy choices, both before surgery to prepare and then after surgery, so that they can have lifelong success. We want to give patients the ability to determine which foods are nutrient dense, to read a food label and decipher what it says, and to wade through the misinformation that they might come across. Many products might claim to be sugar-free or fat-free, have real fruit, or have other health benefits, when in actuality it may be very misleading. Our bariatric dietitians want to work with you to make sure that this bariatric eating plan fits in with your life. So our bariatric dietitians are willing to work with local dietitians, and we also offer eHealth, which allows you to meet with the dietitian through a tablet, a smartphone, or a computer. So we really want to make sure that this plan works for you. Our dietitian is going to create a personalized eating plan for patients using this easy to use, easy to understand tool, these bubble sheets. And these really promote balanced nutrition and regular exercise so that they can have successful weight loss. So our plan is structured for success. We want our patients to have 3 healthy meals a day consisting of protein and low processed carbohydrates. We also want them to have 3 milk or yogurt snacks a day and no other snacking. We want them to sip on 6 8-ounce cups of plain water every day. When I say plain, I mean no flavoring packets or drops, as those can contain acids, which can promote ulcers, which is a major complication after surgery. When I say not sparkling water, we mean no carbonated drinks, no pop, no sparkling water, nothing with carbonation, beer. That carbonation also can contain acids, which can promote ulceration as well as stretch the pouch. We encourage our patients to keep a food diary because that accountability is really going to promote their success. In addition to the bubble sheets that our dietitians will provide to the patient, you can also use apps such as Super Tracker, MyFitnessPal, or Lose It to help keep that accountability day in and day out. So as I said, changing your life means changing your lifestyle. You need to follow the new mealtime habits, including the bariatric eating plan, but also patients need to learn to chew their food more slowly and more thoroughly, as the stomach's ability to churn and digest that food is different after surgery. We also encourage patients to avoid drinking fluid with meals or 30 minutes before and after, as that can stretch the pouch and lead to overeating. We want our patients to avoid all nicotine products, as nicotine can promote ulcers, with bleeding and scarring being the major complication with ulceration. As I said, we don't want you to drink any carbonation, as that can stretch out your pouch or sleeve and can also cause ulcers due to that acidity. We encourage our patients to exercise at least 30 minutes a day. So I've heard Dr. Samuel speaking with patients about the gas tank analogy, and I really thought this was a great way to explain to patients how diet and exercise works to help them. So food is the fuel for the body, and exercise is like stepping on the gas pedal. In order to lose weight and to maintain weight loss, we need to do both. We need to put less gas in the tank, and we need to run the car. Excess gas and minimal driving can make the gas tank and our stomachs balloon out. We want our patients to exercise as much as they can without pain. A lot of our patients can have joint pain or limited mobility. To help with that, we like to give them physical therapy consults so that they can find a way to exercise as comfortably as possible. Some other exercises that can be done for patients with joint pain would be like water aerobics or swimming. Those can be excellent options for those patients with pain. We encourage 30 minutes or more of moderate to vigorous exercise. That means, can you still sing? Can you carry on a conversation? If you can, then you're not exercising vigorously enough. Exercise, as I said, is essential for weight loss, weight maintenance, and to prevent serious complications after surgery. Some other lifestyle changes that patients can expect to make would be changes to their medication. Many of our patients have diabetes, high blood pressure, high cholesterol, and they may be on medications to treat those illnesses. After surgery, greater than 80% of those obesity-related complications are going to resolve, which means you may require reduced dosing or even eliminate some of those medications you're taking now. We also require our patients to have lifelong daily supplementation because sometimes it's hard to absorb as many nutrients as they need. We want patients to avoid all medications that can promote ulcers, namely non-steroidal anti-inflammatories such as ibuprofen or aspirin. So the role of the bariatric nurse coordinator is to work with the bariatric team, hospital personnel, referring physicians, and patients to optimize patient outcomes and improve patient quality of life. We function as the team coordinator, the clinical coordinator, the patient educator, the patient care coordinator, patient advocate, and support group facilitator. And our focus is really education. Consistency is going to be the key to your success. So surgery is only one tool that you need to succeed. Consistent compliance with the bariatric lifestyle, diet, and exercise plan is going to ensure the rest. When I talk about compliance, I mean being cooperative, eager, and ready to change. So research has shown that peer support really does improve patient outcomes. So we offer a bariatric surgery support group on the first Tuesday of each month from 6 to 7, where bariatric surgery clients can come together and speak to each other about different topics and exchange ideas and information. If you'd like to learn more about that, you can contact us at obesitysurgery@uiowa.edu. I've also included some online resources about diet, exercise, and obesity that you can access after the program. So this is a picture of success. This is our success story, Dawn Walker, and this photo is her 1 year, this photo is 1 year ago, her before photo over here. I'm pointing, but no one can see what I'm pointing at, sorry. So here's her before photo over here, and then this is her at her 1 year follow-up. And she is the picture of hard work and dedication, and I would like to introduce to you Dawn Walker. Hi. How are you doing?
Good.
So tell us when you had your surgery.
September 16th of 2014.
Okay, so you just had your 1 year follow-up.
Yes.
It was
on the 18th.
The 18th? Okay.
Yeah.
So what would you tell everyone about bariatric surgery, if you had one thing to say?
It was probably the best thing I've ever done in my life.
So did you have complications related to obesity prior to surgery?
I suffered from hypertension, depression. I was using a CPAP machine, and I had a lot of joint pain.
And did that resolve with your bariatric surgery?
Yes, it did.
Wonderful. In what way do you feel like this changed your life?
I'm just able to do things I've never been able to do. I can run 4 miles. I can get down on my knees, I can scrub my floor. I can play with my kids. I can run after them. I mean, my son's 15, but I am a challenge. So it's been a lot of fun just getting my weight off. And
Fabulous. So was it easy?
no, it wasn't easy.
What do you think the hardest thing was for you?
The exercise was probably the hardest.
Exercise. What motivated you to keep going?
Well, my sons will be getting ready to be married, and soon at one time I'll be a grandmother. I want to be able to get down and play with my children.
Wonderful. If you could do it all over again, would you do it again?
Oh, yes.
Fantastic. Okay. Do you have anything else that you wanted to tell everybody?
No.
No? Well, thank you for coming.